Which is better, the posterior approach to a total hip replacement or the anterior approach? If you are facing a total hip replacement, you might be doing some research into figuring out which one is best for you. Hi, I'm Pamela. I had a total hip replacement with the anterior approach 2.5 years ago when I was at the age of 56. When my doctor told me he was going to do the anterior approach, I was really confused. My only experience with hip replacements at the time was with my mother, who had had one 20 years prior when she was in her mid-70s. And what I remember about her surgery was she had a big slice through her butt cheek, and that's where her scar was. I didn't know that there was another option for hip replacements. So when my doctor told me about the anterior approach, it sounded kind of good, but I was a little bit worried about something that was new and different. So actually a little bit more on that topic in a moment. I created this YouTube channel to talk about total hip replacements from the patient's point of view, not from the doctor's point of view. If you are navigating your own hip replacement journey, I would love it if you would subscribe to my channel. I have a whole list of videos that I'm planning for the future, so when you subscribe, please click the bell icon. That way you'll be notified every time I release a new video. I do want to be clear, I am not a medical professional. I created this channel to talk about what the experience is like from a patient's point of view, both mine and also the stories that people share with me when they comment under my other videos. What exactly is the difference between the anterior approach and the posterior approach? Apparently, the surgery itself is very, very similar in both situations. However, the approach is the difference. And in the patient's uninformed point of view, the approach is basically where the doctor makes the incision on your body, or in very layman terms, what part of your body the doctor cuts into. There is also another approach referred to the lateral approach, which is on the side of your hip. I don't know very much information about that. Apparently that's something highly specialized, so I'm not going to address that in this particular video. My doctor did end up using the anterior approach on me, meaning he cut into my body on the front side of my hip. I have a scar that's really only about 3 inches long. He promised me it would be that long. I didn't really believe him. And then at some point later on, I actually measured the scar, and yes, it really is only 3 inches long. The posterior approach is what my mother and my grandmother had. So in my mindset, the anterior approach was something new and different, but actually that's not the case, and I'll get into that in just a couple of minutes. With the anterior approach, I believe that they also sometimes refer to it as muscle sparing because they don't actually cut into your muscle itself. What they do instead is, yes, they cut into your body, put their tools into the division between your different muscles and kind of stretch them apart. Now, obviously, stretching muscles seems better than cutting muscles, but I will share that at the time of my surgery, I also had a groin strain, which was undiagnosed at that point. Immediately after my surgery, that groin strain was dramatically worse. It took about 9 months for that to heal, and then it came back. But again, that's a topic for a different type of video. With the posterior approach, they do actually slice into the muscles from what I understand. Other than the scar, what really is the difference in the recovery between the anterior and the posterior approach? If you're navigating, thinking about having a hip replacement, you may have had friends or family members tell you you can't bend more than 90 degrees for a certain period of time after you have your surgery, meaning you can't bend forward even to tie your shoes. That actually is only if you have the posterior approach. And even though my doctor gave me all kinds of information and his staff gave me some information also, when I had my very first physical therapy appointment which was at my house a couple of days after my surgery, I said to the physical therapist, now I can't bend over, right? And he said, no, you don't need to worry about that. That's only for people that have the posterior approach. And what he told me was the restriction against bending over really has nothing to do with the actual hip implant itself. The concern for people that have the posterior approach is if they bend over, what they are doing is stretching into the incision and the stitches. And the reason why they don't want you to bend over is because they don't want the incision to pop open. And it's like, oh, okay, well, that makes total sense. And he said to me, because my incision was on the front side of my body, I could absolutely bend over because, yes, it would kind of crunch up my incision, but I didn't need to worry about it popping open. So I didn't have that restriction. And for people who have the anterior approach, chances are good you won't have that restriction either. Having said that, the first couple of days and week or so after my surgery, yes, I was swollen, I was stiff, I was painful. It wasn't very comfortable for me to bend over and tie my shoes. I probably relied on my honey to tie my shoes a little bit more frequently for me, maybe than I needed to. I think at that point I was just feeling kind of weak and wobbly, and I liked the idea that he was doing it for me. But then pretty quickly he kind of caught on, and so then I figured out, okay, I tie my own shoes. What I should have had at the time were something that are called slip-ins. I believe Skechers makes a type like that you don't have to bend down at all to put your shoes on. You basically just kind of like slip your feet in and away you go. I will put in the notes below this video a link to one, so that way you can take a look at what those shoes are like. If you haven't had your surgery yet, that may be something that could be helpful for you after the surgery. If the anterior surgery approach has no restrictions, sounds great. How come everybody doesn't have it? How come every doctor doesn't do it? Well, there are some concerns with the anterior approach. One of the biggest concerns that a lot of people in the medical profession have is with the anterior approach, there is a greater likelihood that the femur will get broken during the surgery. And the femur is that big bone that's in your thigh. In fact, somebody put a comment on one of my other videos that said that she had a broken femur in surgery. And I asked her, was this the anterior approach? And she said, yes. Part of that, I believe, could be because with the anterior approach, there's a special table that the doctors use when they're doing that surgery. And that special table allows them to kind of like drop your leg down off the table, so that way it's at a good angle for them to cut into it, do whatever the heck it is that they do inside, and then bring you back up when they stitch you up. That is another one of the reasons why not every doctor does the anterior approach. While it feels like that anterior approach is new, it is something that has been used almost as long as the posterior approach. But one of the challenges has always been this particular type of table. It's not the normal table that they would have in a normal operating room. From what I understand, that table can cost as much as $100,000 for whatever the surgical center is. I live in Florida, and you can say whatever you want to about all the old people that live in Florida, but where there are lots of old people, especially old people that have money, there are lots of good orthopedic resources. Where I live, the orthopedic industry, I'll use that word on purpose, is very competitive. There's billboards, there's TV commercials everywhere for different orthopedic offices trying to encourage people just like me to use their office versus somebody else's. Those types of places all have the ability to do the anterior approach, meaning they have that really expensive table. If you live in a smaller community where there isn't so much competition between different orthopedic surgeons, or if you live in a country where perhaps you don't have the choice of what surgeon is going to do your surgery, you may not even have the option of having the anterior surgery at all. It could be just your particular doctor that's available to you only does the posterior. And if that's the case, that's perfectly fine for you. The other thing that my doctor told me when I asked him about the anterior approach that he was going to do on me compared to the posterior approach that mom and grandma had was he told me that he virtually always uses the anterior approach. However, if he has patients who are heavy and have a lot of flesh around their midsection, that might be hard for him to navigate in order to actually get to their hip bone, then for patients like that, he does prefer to use the posterior approach for them. So if that potentially is the situation that you have, or if that's the situation for one of your loved ones, even if a doctor might do the anterior approach on a different patient, they may decide that you'll have a better outcome if they do the posterior approach on you. For a lot of people that I talk to, either through the comments on my videos or just, people that I talk to in my day-to-day life, it feels like a big decision for the patient to think, well, gosh, do I want my doctor to do the anterior? I might break my femur, versus the posterior. They're going to cut into some of my muscle. What will my recovery be like? The thing to keep in mind is we're not talking about ordering pizza. Do you want pepperoni or sausage on your pizza? When you meet with your doctor is going to tell you what he prefers to do for you. You don't want to be in a situation where you're trying to convince the doctor that's recommending one approach to do a different approach. The last thing any of us want to be is on that doctor's learning curve. You want to be sure that your doctor is experienced and very, very comfortable with the approach that they are planning on doing for you. Before I had my surgery, I watched a video that was I think it was an industry-specific panel discussion with a couple of different doctors, and they were all discussing one particular brand and model of actual hip replacement. A couple of the doctors were talking about doing the anterior approach. One of the doctors said that he used to do the posterior, he started doing the anterior, he had a patient's femur break, and because of that, he went back to the posterior. Now, he didn't say this out loud in front of his peers in this panel discussion, but that made me wonder, did he not have confidence in himself doing the anterior approach? Was he scared that might happen to another one of his patients? Or did he just feel that the risks in general were too high with the anterior approach, which is why he decided to stick with the posterior approach? What are your thoughts on this? Do you have information that's different than what I shared about the difference between the anterior and the posterior approach? Or do you have information about the lateral approach? Because as I mentioned, that's something I really have little information on. If you do have any more information, I would love it if you'd put it in the comments below this video. At the time that I'm creating this video, my channel is still small enough that I read and respond to every single comment. But even more than me looking at them, other people out there look at your comments too. And so if you have a piece of information that could potentially help another person, I'm sure that they would really value what it is that you have to say to them as well. If this video helped you, or you think it might help somebody else, please give it a thumbs up. And if you'd like more unfiltered, real person information about what it's like to have a hip replacement, recover from it, and have a vital life into the next decades of our lives, please subscribe to my channel. I have a whole list of videos, not just on hip replacements, but on thriving into our last years that I have planned for the very near future. Until next time, take care, and I'm rooting for you to have a great, vibrant life.